Today I'm going to place the patient on a partial rebreathing mask. First thing I'm going to do is check the patient's order for appropriateness and hospital protocol. Then I will check the patient's chart for any significant findings. I will then grab all the necessary equipment, which is the partial rebreathing mask, stethoscope, and pulse ox. I will then proceed to wash my hands if they're not visibly soiled with 3 ml of sanitizer, rubbing for at least 15 seconds or when dry. And then I will continue to place my gloves on. And I will enter the room. Hello, Mr. Johnson. My name is Mike from Respiratory. How are you today? Good. Today I'm going to give you some oxygen via partial rebreathing mask. But I need to do a couple set of vitals and check your identification. I'm going to check your name down here real quick. Can you tell me your name and date of birth? Great. Like I said, I'm from Respiratory. My name is Mike, and I'm going to put you on some oxygen via partial rebreathing mask. And if there's any family members here, I would ask them they understand the procedure. Do you have any questions? Okay, good. I'm going to go ahead and take a set of vitals. I'm going to check your heart rate, palpate for 1 minute. Check respiratory rate for 1 minute. I'm going to auscultate, making sure that it's functioning, and warming it up. Take a nice deep breath in and out. 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 And deep breath in and out. If the patient's able to, I will direct them to cross their arms on their chest, lean forward so I can auscultate posteriorly. And then I would check saturation via pulse oximeter. Grab my equipment. Since this is a partial rebreathing mask, I want to make sure that the reservoir flap is removed and the side flap here is removed. I will set the mask a minimum of 10 liters a minute. Make sure the reservoir bag inflates. Checking if it's functioning. Great. Okay, sir. I'm going to place this right over you. I'll proceed to monitor the patient, take some breaths to make sure that the bag doesn't fully collapse, and maintain a third to a half full on inspiration. I will then take another set of vitals, take a heart rate for a full minute, respiratory rate for a full minute, auscultate anteriorly, auscultate posterior, check saturation via pulse ox. How does that feel, sir? You feel comfortable? Great. Do you have any other questions for me? Check the family member if they have any questions. If not, thank you, and I'll see you a little later. I'll proceed to remove my gloves. Wash my hands with 3 cc's of sanitizer, rubbing for at least 15 seconds when dry, and then I would exit the room.